I am Mary Trewatha. I'm from White, South Dakota. I'm a teacher at Newburgh Area Schools, and I've been there for 41 years. This is my 41st year of teaching. I have been involved with the Brookings Health System wound care 3 times, with 3 different visits, 3 different surgical scenarios. In 2015, I'd had a series of surgeries, from flesh-eating bacteria to whatever, and so I had like almost over 27 inches of incision, and it wasn't healing, and so I was referred to the Brookings Wound Care to possible wound vac. The second time I was at wound care was in 2021. I had a hip replaced, and it wouldn't heal. We tried stuff here at the wound care center at Brookings Health for 3 months. We couldn't get it to heal no matter what the team tried, and so then we placed a wound care vacuum, which took another surgery. My third experience was in July of 2022. I'd had surgery and ended up with a wound vac from Sioux Falls for Vera McKinnon. So I came back here to have it worked on and to do my wound care here. And so from July till the end of September, I was coming 3 days a week for wound care. A wound vac is one they put on, and it's actually a small vacuum that you can get here from the wound care center. It has to be changed out every other day. Basically, they take and prepare your wound, and there's a sponge that goes into your wound, and it literally goes into the incision, into the wound. And so there's constant suction from this wound vac on your wound at all times, so it promotes constant healing. On each visit to wound care, they're very friendly. They take you back and get you comfortable. We like to laugh and joke a little bit and be comfortable. And then they would take and unbandage the wound and then disinfect it, clean it, do whatever treatments it needs to be done, and then would repackage the wound again. When we were working on all of my wound care, every time we'd have a different treatment, the wound care staff would tell me what was going to happen, why they were doing it. They'd explain everything, and then would walk you through it step by step as they were doing it. If it took home health care kind of thing, my daughter was the other one who helped me do stuff. They would even say, go ahead and bring your daughter in, and they'd teach her how to do stuff so that we can continue and just make sure that wound would continue healing. I've had wonderful experiences all 3 times with the wound care team, from 2015 to present. And it's kind of strange. You kind of actually start missing them when you're no longer going there. They treat you as a person. When you see them 3 times a week, you kind of become a family, or at least good friends. And we laugh and joke, and that helps relieve, even when you know they're going to rip the sponges out and it's going to hurt. That kind of stuff. They really care. They let you know they care, and so it's been a wonderful experience. Not one I want to live through right away again, but they were great, given the circumstances of the wound care. For me, it's very important, being a teacher, to have healthcare facilities close to home, because for me it was a quick trip in, 15 minutes I could be here. If I'd had to drive to Sioux Falls, I would have ran out of leave, which would really have cut into my ability to teach, carry on my profession, which I love, kind of thing. And so it's just very important that the wound care team and the Brookings Health System is close so you can get that quality care. What I appreciated most about my care from Brookings Health System was the personalized care and the friendly family atmosphere, and they take care of you as a person. They don't look at you as a number or another case or, room whatever, whichever number it is. They really treat you as a person, and it's very family-oriented and very warm and caring. I would highly recommend Brookings Health System. It's a very caring family atmosphere. They care about you as a person. They treat you as a person. They treat the whole person. If you're having a bad day, they'll talk to you about if you're having a bad day, those kind of things. And so you really matter here at Brookings Health Service. And so I would say, highly recommend anybody to come and join the family.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.